Some programs tell their patients when they've had weight loss surgery, don't use straws. Other programs tell their patients once they've had surgery, it's okay to use straws. So, which one is true? Can you use straws or can't you use straw? So the argument with not using straws is people sit there and say, hey, if you use a straw, you're going to inhale too much air. I don't know about you, but I've grown up my whole life using straws. My daughter can use a straw just fine. She doesn't seem to choke on her air. But if you look at a cup and you take a big cup, what do you do when you drink? You open your mouth and there's a big inhale, right? Did you guys hear all that air? You can do the same thing with a straw. You can slurp on a straw. Haven't you done that before? Okay. So the argument around straws is about air intake. Listen, I'm going to tell you this right now. Air is not going to cause complications. Your air is not going to make you have a leak. Air is not going to make your anastomosis come apart. How do I know this? Because you are always swallowing air, non-stop. Whenever you're talking, when I swallow like that, I swallowed air. When I take a deep breath, I'm not stupid. Not all of the air is going into my trachea and my lungs. Some of that air is going into my stomach, right? So air is always coming into my GI tract. So to sit there and tell patients don't use straws, right, doesn't make any sense. And the reason why this has persisted is probably somebody, some doctor, somebody thought it up, some patient choked, some patient had a complication, and they just happened to be using a straw, or they happened to be taking a gulp, has nothing related to it, and then we just associate it. It doesn't mean it caused it, right? But here's the bigger issue with straws that no one talks about. The real question you should be asking is this: what the F are you drinking? Amen? What are you drinking? Why are we so worried about the straw? Why aren't you worried about what's in the cup? If the cup is water, I don't care if you use a straw or if you drink it like this. I don't care. It's water. If it's soda, not using a straw is not good. Using a straw doesn't make it better. If it's soda, the content of the glass is so much more important than the method by which you imbibe it. Does that make sense what I'm saying? So that's it about straws. My patients use straws. If you're one of my patients, they'll tell you, we use straws. I've had dinner clubs with my patients and they're using straws. I don't freak out. I don't go, oh my God! Now, having said that, please listen to the advice of your surgeon and not some crazy dude on Facebook. Dr. Vuong here. If you like this video, I hope you will come learn from me live in person at my first ever Dr. V weekend workshop. I'm calling it Unleash the Sleeve Within. All right? So it's in Albuquerque, March 23rd through the 25th. There's a link to it below the video. I hope to see you there. Cool? Bye.